Thank the nearly 60,000 people that came forward to get tested in New South Wales in the last 24 hours. The testing numbers are holding up really well, and we're deeply grateful that people are coming forward to get tested. Can I especially implore people who are carrying out essential work outside their home to make sure they don't go to work if they have symptoms. Yesterday to 8 p.m, New South Wales had 24 cases of local community transmission. Half of those were cases that were exposed in the community. A number of those cases were people who were conducting work in the last few days, some with symptoms, and we can't continue to have that happen. Whilst around half of the cases were in isolation for all or part of their infectious period, the fact that half were in the community for at least a few days whilst infectious is a cause of concern, and that's what we'll be looking at in the next few days and beyond as a measure of our success. We can't afford to have people continue to have the virus going about their business. We cannot continue to allow that to happen, and we are seeing, even though we're seeing the venues that people are exposed at obviously less risk because we're all in lockdown, hospitality venues and the like are not posing a risk, but people going about their business, shopping and interacting with others is causing the virus to continue to circulate, and we can't have that happen. In too many examples, we're seeing workers who are leaving the house with symptoms or going to work with symptoms, and then inadvertently, as they're going about shopping or other activity, they're passing it on to others. So it's really important for us to stress that where you can, do your shopping online. Where you can, don't go to places where there's lots of other people, because the virus is still circulating in the community. And the purpose of the lockdown, if we want the lockdown to succeed, all of us have to minimise our movements. All of us have to minimise our interaction with others, as difficult as that is, to make sure that the lockdown is successful. We know how transmissible this variant of the virus is, and we need to respond accordingly. So can I please urge anybody who leaves the house, assume that you have the virus or that people you come into contact with have the virus, and act accordingly. This is so important for us moving forward. Dr. Chunt will obviously go through all those cases and provide more details from a medical perspective, but I just want to urge everybody to take into account that even if you're going out doing essential things like essential work, or more frequently, if you're going out just to do your shopping of essential service or products, please note that the disease is still circulating and we don't want it to circulate further in the community. The whole purpose of the lockdown is to stop community circulation, community transmission, and that won't happen unless people stop interacting with one another, especially if they have symptoms. Can I also say how pleased I am to announce today that the New South Wales Government, through New South Wales Health, and I want to thank the entire New South Wales Health, the Secretary and Deputy Secretary Pearce who are here today, for managing the New South Wales Government's contribution to support the federal government's vaccine rollout. I'm pleased to say, as you know, the new vaccination hub in the Hunter is underway and will be open to the public. The New South Wales Government will also be opening up a mass vaccination centre in the Illawarra in Wollongong, but also one in southwest Sydney in Macquarie Fields, which is really important to get to the southwest community. We'll also be having a major additional hub in the Sydney CBD. So in addition to the 100 sites, in addition to the mass vaccination hub we have in Homebush, which is proving to be a great success, there'll also be the one in the Hunter, in the Illawarra, in Wollongong, in Macquarie Fields, another one in Pitt Street, in addition to the 100 sites that are available across the state. We envisage that once these centres are up and running, that New South Wales Health will be able to administer up to 200,000 vaccines a week. At the moment, we're doing around 100, 110, which is a great achievement, but we know that we'll be able to get capacity up to 200,000 once these mass vaccination centres come online. I'm also pleased to say the New South Wales Government has been working with the Pharmacy Guild here in New South Wales. From 19th of July, there'll be 22 pharmacies that will be coming online, initially in our rural and regional communities where communities don't have access to any other GP or a New South Wales Government Health site. In areas where there's limited rural and remote access, that's where we'll be starting the pilot with 22 pharmacies. We know the Pharmacy Guild in New South Wales is keen to do more. We know they all want to come online, and we're keen for them to do more as well. But from the 19th of July, which isn't that way away, 22 will be coming online, and we're having ongoing conversations with the Pharmacy Guild. New South Wales Health and the Pharmacy Guild are having conversations about how we can scale that up as soon as possible. But obviously we've got to discuss issues with them with consent and other things, but we're really keen to get them on board, and at least from the 19th of July we get out of the starting blocks. 22 will be available in rural and regional communities, but we're hoping to scale that up very quickly. Because we know once those extra supplies arrive, the challenge will be to having all hands on deck. So we're doing our part through New South Wales Health, through our mass vaccination hubs, our 100 sites around the state, plus getting pharmacies online. And also, of course, we'll start having conversations with the business community about having on-site vaccinations available at workplaces as well. But of course, we're also hoping more GPs will come online and that GPs will be able to scale up as well. And the Commonwealth, we understand, is having those conversations. And I just want to, again, give a good shout out to our GPs and thank them for the work they're doing. We know how critical they are to the mass vaccination or the mass vaccination rollout in New South Wales, and we're really keen to support their efforts in getting more doses to them, but through the federal government, but also getting more of them online.